Welcome to the Med Spa Method. I'm Leslie Schweitzer. I'm a doctorate prepared nurse anesthetist, and I started a medical spa called Lush Aesthetic Bar in 2022, and it has grown, and we have tweaked the name a little bit over the years, and we are now Lush Aesthetics and Wellness. And this podcast is your guide to the med spa world. It's your guide to the treatments that are going on in these medical spas, and what you can do to get the best out of your treatments, what you need to know going into your treatments, and what you need to know to kind of spot the treatments that you do and do not want for you. So this is an educational podcast. A lot of the episodes are going to be just me talking about things that are going on in the medical spas, but I do have some special guests along the way to add some commentary and some fun to these episodes. So let's get into it. This week on the Med Spa Method, I want to talk about SkinPen Microneedling. Now, I had done an episode on microneedling a year ago on an old podcast, so you might be able to find that out there somewhere, but I love microneedling so much that I wanted to talk about it again. SkinPen will always hold a special place in my heart because when I started Lush Aesthetic Bar, SkinPen is one of the first things I brought on. I started with Botox, lip filler, and then the very next thing I brought on was SkinPen. And the reason that I wanted to bring on the SkinPen brand is because they are the most studied, and they are the first to achieve FDA approval and wonderful results, which they can prove through all of these studies that they had to have done to achieve FDA approval. The reason that FDA approval is important in a device like this is because microneedling is just that. It's a lot of little needles, and they're going to be puncturing your skin. So having the clearance from the FDA to say that the device is safe and clean was really important to me. I had heard horror stories about devices where you get them under the microscope. They're not cleared, obviously. Get them under the microscope and you notice that the needles aren't all uniformly shaped, or they're jagged, or they even found rust on them. And that was harmful to the skin and caused damage over time. I also know of devices that are kind of like spring-loaded instead of like driven, like pneumatically push and pull the needles. And those devices, since they are driven by the amount of pressure in the operator's hand, you can drag the needles and cause scarring and damage as well. So with the SkinPen brand of microneedling, you can feel confident that the treatment you're getting is not going to damage your skin because those needles have been clean, tested, they're sterile, and the device is pushing and pulling those needles and not dragging them across your skin. So that's just a little background on why I wanted to choose the SkinPen device for my medical spa as a device. But the reason I wanted to choose microneedling is because microneedling as a treatment is a wonderful way to use a device to stimulate natural response. So many of my clients came to me and said they wanted to look natural. These were their goals. They wanted to look natural. They wanted to look younger. They wanted to work on fine lines, wrinkles, and plumping the skin. But they didn't want to do a bunch of cheek filler, chin filler, jaw filler, under eye filler. They didn't want to do any of the big fillers. It was a common theme that I was hearing. And they didn't want to look unnatural. And they didn't want to do unnatural things. They had no interest in chemical peels, which can also achieve similar results. Chemical peels are wonderful for fine lines, wrinkles, dark spots. But They wanted to achieve these results in a natural way. So that drove me towards microneedling, because microneedling can do all of those things. The device just starts the process in your own body and tells your body what to do. So by using this device, it's got 16 needles, the SkinPen device, I guess I'll speak to in particular. So if you've got a medical spa in the area that doesn't use the SkinPen device, perhaps you start by asking them why they chose that device and hear from them. I hope they have a wonderful reason other than price tag fit into their budget. But the SkinPen device has 16 clean, sterile needles in a single-use cartridge, and those needles push and pull into your skin at a depth that is dialed in by your injector. And we use different depths for different areas on the face. And those needles cause a repeated trauma on purpose. Now, this repeated trauma is going to kick off this cascade of events in your body, telling your body, hey, right here, we're injured and we need to repair. So the point is to send healing cells to your body. This is where you need to be healing, and telling your body to repair it in the way that it naturally was. So that means increasing collagen stimulation in the cheeks, where your body had a lot of collagen at one time. That means sending brand new baby skin cells to repair all of those tiny little holes. And what's great about brand new little cells is they are not already pigment stained. So when we have cells that are pigment stained from the sun, freckles, even melasma, we're breaking those up and we're getting rid of them. And we're telling your body to replace those broken cells with fresh, clean cells. Now, we're not going to remove a full age spot in one treatment, because the microneedling device, those 16 needles, they hit a lot of the areas of the skin, but 100% of your skin will not be damaged and coming off. A good amount of your own health, like skin that's there, will be there to guide the new healthy skin coming forward. So you do get a little bit bloody in this treatment, which is something that freaks people out a little bit, but it's worth it, I promise. I send my patients home to sleep in their blood, what has come out during the treatment. I say, if you can, leave this blood on your face, because blood is healing. It's got those healing platelets in it. Go home and just leave this alone and stay home today. And tomorrow morning, wash your face and you'll just be a little bit pink. And that's just a wonderful way to go home, rest a little bit. Wonderful way to increase your healing is to just leave that blood on your face, because blood is naturally healing. Now, some ways that we can speed up the healing process and improve results is to add something like your own platelet-rich plasma to the treatment. So platelet-rich plasma is when we draw your own blood and we spin it down in a centrifuge with an additive called ACD type A. And we take that spun down blood and we take off just the layer of platelets and we apply that to your face. Now, there's kind of two ways that people will do this. They will use the platelet poor plasma, which is still your plasma, it just doesn't have as much platelets in it. And they'll use that as the glide during the procedure. And what I mean by glide is that we need to put something on your skin to help the device kind of slip and slide over the top of your skin. So applying it as part of the glide helps, because we have it anyways. And we can punch it into your skin, if you can imagine the needles kind of pushing it into your skin. So that's a benefit. And then at the end of the procedure, we can take the platelet-rich portion and we can put that all on top and let the platelet-rich kind of just soak in. I don't like it when people take the platelet-rich portion and use that as the glide, because what the needles do when they're going in and out and punching it into your skin is they're also breaking and fragmenting apart all of those platelets, and we'd like them to be whole and functional so that they can bring healing to the area. Now, the other way that people use the platelet-rich plasma in this treatment would be to use the glide that comes in the kit, which is called Lift, and it is a wonderful glide. I love it, the brand. It's made by SkinPen, and it's meant to be used in that fashion, but it's a slippery, moisturizing glide that can be punched into the skin, and it's named Lift because it's helpful in lifting the age spots. So I think that's a wonderful treatment as well, is to use the product as it was tested and meant to be used, and then the top layer would still be those platelet rich layer of the plasma to speed up healing time, but again, we're not pushing that into the skin and fragmenting all of those cells. Some other places are using some exosomes or growth factors as that either the glide or that top layer after the treatment, and those have their benefits as well. One of the benefits is you don't have to have a blood draw. The product is already made in a lab somewhere and it's sterile and it can be applied. And those products that are being applied to your face should be studied, and they should have their own approval and their own studies that show their efficacy. One brand that we have used and loved for this purpose is the Anti-Age. Those products, they have growth factors. They have one that has growth factors as well as having tranexamic acid. It took me a moment to come up with that word. Tranexamic acid, which is wonderful for brightening. And they also have one that's specific for hair growth, which is beneficial if you're going to do microneedling on the scalp to stimulate hair growth. So those are some that we've worked with, but there are growth factors and exosomes by other brands. And if your injector is going to be using that, I would just encourage you to ask about it. Ask about the studies and the approval and the efficacy before you move forward with that treatment, because it would just, I haven't heard of any exosomes that have been harmful, but I would find it frustrating to pay for something that isn't studied as effective either. And, maybe I'm wrong. Maybe there are some that are harmful, and I would just hate to be the one to steer you into that direction. So my advice would be, let's ask about those studies, because your injector should know what's going to be the most effective for you. And lastly, the benefit of going with exosomes or growth factors instead of your own natural PRP is age. As we get older, our PRP is less and less effective. So if we're 65 and using our own PRP, well, that's the PRP of a 65-year-old. But if you use growth factors, the growth factors made by Anti-Age, so I'll speak to them, have been harvested from 18 to 24-year-olds, and then they have remade those in the lab. So they're lab made, but they came from a healthy 18 to 24-year-old. And that greatly improves the efficacy of that product just because it came from a younger specimen. So avoiding the blood draw and potentially increasing the results due to the age of the specimen. So now that we've talked through how the procedure goes, I should mention that this is something that you will be numbed for. Having 16 needles repeatedly in and out of your skin is something you want to be numbed for. It is a little bit uncomfortable. So the numbing cream is applied and it needs to sit for about 20 minutes. And then the numbing cream needs to be washed off. We do a double cleanse because numbing cream that gets microneedled into the skin can be harmful. So it's just safer to make sure that we've double cleansed it off and are absolutely certain that it has been removed and your skin is clean and ready for this procedure to occur. Once we have double cleansed your face, then the new cartridge is applied, and we would start by putting that glide called lift onto the face. Lift is then kind of dotted around each treatment area, and the pen glides over the top of it. For me and for most clients, we would all describe the forehead as the worst area because your forehead doesn't have much fat at all, and the fat is kind of a nice cushion for the treatment. So once we have done the treatment across the forehead, kind of the rest of the face is like easy breezy. And we choose to go all the way down to the collarbone because I feel a treatment should be face and neck. And then we do have some clients who want to do the décolleté, and we can add that on if you'd like to treat the sun damage on the décolleté or the fine lines and wrinkles across the décolleté as well. Once the treatment is completed, you will have little blood spots across your face. In some areas, it's more common to have blood on those areas that don't have as much fat, like down the bridge of your nose and on your forehead. Once that's done, then we would apply the last layer of PRP or exosomes, or maybe just a little extra lift if you're not going to be doing a boosted treatment with growth factors, PRP, or exosomes. And then we would tell you to go home and leave it alone until the next morning. The next morning, we'll have you cleanse it off with a gentle cleanser. And then you would start using a product very similar to Lift called Rescue, which is again made and tested with the device. Rescue has a little bit of niacinamide, which is wonderful for redness. So it's very helpful at reducing your downtime. So I have patients put that on at least twice a day, but it's a small bottle and it's only meant to be used for 24 hours. So I tell them, put it on as much or as little as you need to, but at least twice. So if it bothers you to keep putting something on, just do it morning and night. But if you can kind of take it with you and if you feel dry throughout the day, just put a little bit more on. On the third day, I allow people to start applying makeup. I do encourage that they use a mineral-based tinted sunscreen as their foundation for a couple of days because these mineral-based tinted sunscreens, the ones we carry, are post-procedure safe. They offer you a little bit of coverage, and the zinc that's inside them is also very calming. So it's a wonderful it's a wonderful way to soothe your treatment and improve your healing time if you apply a zinc-based sunscreen starting on day 3. Now, those previous days, I'm not having people put sunscreen on, but I'm also telling them to stay out of the sun. So just a little disclaimer on sunscreen. We got to wear sunscreen. You do not want your fresh baby skin to come through and be damaged right off the get-go. But you're just not ready. Your skin's just not ready to accept sunscreen until day 3. So we're staying out of the sun on those days. And in Wisconsin, that's usually not an issue. We have about 2 months where it's incredibly sunny here, and it's a little bit harder to accomplish, but a wide-brimmed hat sitting in the shade and some time indoors, and it should be able to be accomplished. The rest of the healing time will usually result in a little bit of dryness in a couple of days. And then dryness sometimes follows with flaking of the skin. It doesn't always happen. And a couple of factors play into that. Like, what was your skincare routine beforehand? If you were a heavy retinol user and your skin was used to turning over kind of quickly, you're not going to experience much flaking. But if you've never used a retinol before ever, you're going to flake. It also matters on how aggressive your treatment was. Now we have some people who want a very aggressive treatment, And we have some people who don't want an aggressive treatment. They just want a more gentle treatment. And so to some degree, the aggressiveness of your treatment will play a role in your healing process and how much downtime you'll be having. We recommend doing this treatment once every 6 weeks. We choose that interval because it's what was studied, and has been shown that it takes about 6 weeks to go through the entire healing process, stimulate collagen production before you're ready for your next treatment. So I like to follow that guideline in addition to being wonderful for fine lines, wrinkles, and pigment. It's also for treating acne scars. And we do treat acne scars with a CO2 laser as well. But the caveat here is an acne scar is often found in the younger population that otherwise doesn't need a CO2 laser quite yet. So I find that the SkinPen is a more appropriate treatment for their skin. The reason it's so wonderful for acne scars is because the little in and out of those needles is breaking apart the tether that those scars are tethered down and causing them to kind of dip in on your face. So by breaking that up, breaking the tether, and by breaking up the scar tissue itself and sending those new healthy skin cells to replace it, over time, you will see massive improvement in your acne scars. That being said, scars are very difficult to treat, so it's normal to require about 6 SkinPen treatments when we're talking about scars versus 3 SkinPen treatments when we're talking about fine lines and wrinkles. We're also talking about maintenance with the SkinPen, so we would be doing 3 to 6 treatments in a series, and then after that, moving into 1 treatment or 2 treatments per year to maintain your results. You don't have to just do SkinPen to maintain your results. This is somewhere where you could change up your routine and you could do a chemical peel in there somewhere. You could do a CO2 laser somewhere to maintain your results. You could do an erbium laser. There's a lot you can do, but a resurfacing treatment of some sort once a year is a good plan to have in mind once you've decided that you want to, keep aging at bay or maintain the results that you've worked so hard for. You need to maintain that result with some sort of resurfacing treatment at least once a year, and more than once a year if we're using a lighter, more gentler form of resurfacing, such as chemical peels. So thanks so much for sticking with me over this SkinPen microneedling talk. Again, this is a very loved treatment of mine because I've had it so long, and I've had plenty of treatments myself with it, and I just love the results every time. I love the process, and it sounds scary at first, but once you've gone through it, everybody loves it. They don't love the period where you go home and you have a little bit of blood on your face and you look a little weird, but the next day already just feeling your skin starting to be fresh and new, and then turning it to this glowing, beautiful complexion over the next week is just a wonderful experience. And it's very different than healing from a laser, which I have talked about in the past and would love to do more episodes on various laser treatments. So again, thanks for sticking with me on this SkinPen talk, and I'll see you next week.